Hello, my people. Today I'm going to take you on a topic called blood pressure. Now, blood pressure is the force of blood pushing against the wall of your arteries as your heart pumps blood around your body. Now, we want to understand the readings of the blood pressure. Now, there is two types: the one that sits at the bottom and the one that sits at the top. Now, the one that sits at the top is called the systolic, and the one that sits at the bottom is called the diastolic. Now, the differences are: the systolic measures the pressure in your arteries when your heart contracts and pumps blood out, while the diastolic measures the pressure in your arteries when your heart relaxes between beats. Now, let's go into deep about the normal blood pressure, the elevated and the higher blood pressure. Now, the normal blood pressure is anything less than 120/80, which is normal. From there to the next one. Then if we talk about the elevated blood pressure, there is the systolic that sits between 120 to 121 and the diastolic that is less than 80. That's when it's considered elevated. Now, when it's considered high blood pressure, which is called hypertension, you understand, we have two stages or even more than that, but let's focus on two stages. So the stage one is where the systolic is between 130 to 139 and the diastolic is between 80 to 89. And then we have the stage 2, which the diastolic sits on 140 or higher, or diastolic sits on 90 and higher. Now, something very important: hypertensive crisis is where a systolic is higher than 180 and diastolic is higher than 120, and this is where you require immediate medical attention. I repeat, immediate medical attention. So now, some of you might ask, why is blood pressure important? It is. Maintaining healthy blood pressure is crucial for overall health. Understand? High blood pressure can lead to serious healthy problems, including heart diseases, stroke, kidney diseases, visual loss, and aneurysm. Now, let's talk about the heart diseases, which increase the risk of heartache and heart failure. And then when we talk about the stroke, there is this damage to the brain, you understand, due to the blockage and the burst blood vessels that comes in it. Then when we talk about the kidney diseases, the high blood pressure can damage the blood vessels in your kidney. And let's not forget about the eye, visual loss. High blood pressure can damage the blood vessels in your eyes. Oh yes. Now let's talk about the factors that can affect these blood pressures. So such as age. So blood pressure tends to increase with age. Okay. Then weight. Being overweight or being obese can rise the blood pressure. Diet. High salt intake and low potassium intake can contribute to high blood pressure. So mind what you eat. Then physical activity. Lack of exercises can increase blood pressure. Of course, let's not forget about smoking. Smoking raises the blood pressure. Alcohol consumption also can increase the blood pressure. Stress can cause temporary increase in blood pressure. And let's not forget about medical conditions. Conditions like kidney diseases, thyroid disorder, and sleep apnea can affect your blood pressure. Medications also can affect it. Certain medication can increase blood pressure. And let's not forget this: genetics. High blood pressure can run in the family. Now, last but not the least, checking and managing your blood pressure. Regular checkup. Having your blood pressure checked at least every 2 years or more often is recommended by your doctor. But then I personally would say once in a while, just check it in the morning and in the evening to see. Some of us might have severe headache and pain, and then like I'm not stressed. What's going on? You understand? And this is where you check your morning and evening blood pressure to ascertain. But normally, check it every 2 weeks. Home monitoring. You can purchase a blood pressure monitoring for home and use it to track your reading. In this one, you don't need to go to any GP practice or any local hospital for that. You can buy the blood pressure machine, do it in your own home at your own convenience. Lifestyle changes. Making health lifestyle choices like exercises, eating a balanced diet, managing your stress, quitting smoking and drinking can help lower and manage your blood pressure. And of course, medication. If lifestyle changes aren't enough, your doctor may prescribe medication to lower your blood pressure. You may ask, what is the best time and when is the best time to check this blood pressure? And I will say, the blood pressure tends to be high in the morning and lowest at night. You understand? It typically starts to raise in a few hours before waking up in the morning, and it continues to increase during the day, which around the peak time is the midday. You understand? And it's usually decreased in the late afternoon or evening, reaching to the lowest point where you sleep. Some of you may ask me, can lack of sleep make the blood pressure go high? Yes, lack of sleep can raise your blood pressure. Consistent insufficient sleep can increase the risk of hypertension, both in children and in adults. That's why our children need to sleep early, at least 8 to 9 hours. We the adults, yes, we have a lot of things and all that, blah, but we also need to prioritize our health. Let's make sure that we prioritize our health. Pressure, high blood pressure is real and it's very dangerous. Start now to manage your high blood pressure if you have one. Start now to once in a while check your blood pressure to make sure that it's not going or pointing towards high, but it's normal. Okay, so that is it. For today, I have talked about blood pressure. Who knows what I'm going to talk about next? If you want me to talk about something, please use the comment section. Some people have done that already. I have done so many posts already. I might not be posting some of them here, but use the comment section. Tell me what you want me to talk about, and I'll be glad to bring it down here for you. Okay? Please do not forget to like, share, repost, and subscribe to my YouTube channel. And also follow us on Love with Passion on Facebook, on YouTube, and also I'm also on TikTok with Aminwa as well. Thank you very much and love you all. Do not forget to share, like, and comment. Bye.